Why don't we just get rolling though? So, day 5, we're at the end of the week. 1 week almost behind us. So there's been a lot going on. I think it's been a very, very busy week. So again, welcome to media availability and looking forward to some questions. So I think the first one I just heard, go ahead.
So yeah, I'll just jump right in. We're hearing there might be a bill today or in the near future about 3.2 beer. Curious what your motivations of the bill and your thoughts on its
I have a bill file open. This has been up in the air for 2 years. I think there's been talk of products leaving the marketplace because they just don't manufacture them at 3.2 anymore. Caused by Colorado and Kansas taking 3.2 products off the market. And they are not making it mandatory. That's what's in the grocery store. So the production line beers are heavier in alcohol than 3.2. They're basically we would change to 4.8 is what the bill asks. We move from 4.8 by volume and to 6% by weight. So we go from 3.2. We're now at 3.2 and 4, and we would go to 4.8 and 6.
I'm sorry.
That's what the bill does.
Sorry, again, you're 3.2 and you would go to 4%.
No, we are now at 3.2
right.
and 3.2 and 4.
Okay, I
so
see.
What that
I see.
Volume
right,
by weight.
Volume
and weight.
Yeah.
And we would go to 4.8 and 6.
Okay.
What are your thoughts on its odds in the Senate and the House? Alcohol laws are always a little tricky.
I don't know. You know, I've lived all the way from being a hero to having my head handed to me in my hand. This is probably one of either. So, but we have a gap here. This will still leave Utah at the very lowest alcohol, or we will be tied with Kansas for the lowest alcohol content in their fruit products in the store. With the exception of Michigan, but Michigan's a real outlier because 3.2 you can buy in a grocery store, but they have liquor stores that serve a full contingency of liquor in Michigan on every corner. They're about like convenience stores are here. So.
Would that fill the gap though? Because these products are starting to disappear. Do manufacturers make products that are at 4.8?
They do. That's
okay.
That's more the norm.
Okay.
Now, will it fill the gap? No, but it'll fill probably 90% of the gap.
Are we already starting to see those products disappear from the shelves, or is that?
We are. There's some products that are leaving now, and what we've kind of been waiting on is to see what. Again, Kansas was 50%, almost 50% of the production of 3.2, and they've just taken that off, and they've gone to the heavier spirits. And then you've got, not spirits, but heavier beers. And then you've got Colorado, they just made the changes and so that wasn't what was mandatory in grocery stores. And so the manufacturers are saying, gosh, Utah, you were 29% of the market, and now you're 50% of the market, but we really don't know that we can produce for that. So they're taking some brands off the market, things that aren't common. Some things will stay. Light beers, literally low-calorie beers, will probably not increase in alcohol content a lot because if you increase the content, you increase the calories.
So it's your bill.
My bill.
And the bill file's been opened.
The bill's ready to. Well, I'll probably have a number this afternoon.
Okay.
I'm sorry. Can we just be super clear? 3.2% is by.
That's by volume.
3.2 is by volume. So what would the by volume change be?
Then the volume change would go to 4.8.
By volume. To 4.8 by volume. And is that the standard around the country?
And that's a very standard production line beer.
Okay. So what's the 6 then? Is by weight?
6 is the weight.
What's the current by weight?
4.
4% by weight to 6%. Okay. Sorry, I'm from Las Vegas. We don't really know.
You know, they don't even measure it down there. They just pour it in glass.
So okay. And I drink beer, so I should know this. But the bottom line is 3.2 to 4.
To 4.8.
4.8. Okay. And then 4 to 6.
And 4 to 6.
6. Okay.
Makes sense.
Okay. Good question.
Do you want to weigh in
What-
on
what-
that, President?
Why don't we go to Medicaid, okay? I think that might be, Medicaid might.
I missed those questions. They're coming in late.
Medicaid may drive some of us to drink. so.
I really do have an appropriations meeting, so I'm gonna.
I just wondered, President, if leadership
Senator
is
Hemmertson, he's
behind.
been talking to
Yeah.
Senator Christensen, he may have even more of an update, so.
Thanks.
I'll let him answer questions since you've heard all of my answers, okay?
Hope I don't contradict what you say.
Hopefully not.
Senator, tell us the status of SB 96. I understand there's another substitute being drafted, and what the status of the fiscal note.
And that is, so there's some technical changes. There is a substitute being drafted with some technical changes in it. We're hoping to get them both done today and have them available to people all weekend long. But that's kind of where things are.
So if they're available all weekend long, the idea would be to vote on Monday?
That's ultimately not my decision. That's what I would vote for, but that's not my decision.
We, again, need to move expeditiously because we need to put it in our statutes so we can apply for the waiver. But we want to make sure we follow process, and we're waiting on the fiscal note, and we want to make sure we've heard from colleagues that they'd like to review the fiscal note, want to give that type of courtesy.
Senator Hemmer, there was a fiscal note released to the sponsor yesterday. Do you know the total amount on that fiscal note? I know there were issues with it,
I
but
don't know.
where are you working from? What number?
We're trying to have a fiscal note that has a number that conforms with the amounts we're appropriating to fund. I never saw the other fiscal note, and I'm not being cute with that answer. I really did never see the fiscal note. I know it came in at a number that people weren't excited about, but these fiscal notes, look, most of my professional career was spent in making assumptions relative to financial assets. This, we're making assumptions, and based on how the assumptions are made, you get a different answer. And we're working to get the best assumptions to have the best answer on the fiscal note. But I never saw the earlier one.
And I didn't see it, but I heard about it, and apparently there was problems because I think the initiative raised sales tax, but in the sales tax portion, if you know, we have some earmarks inside of sales tax. And so you want the Medicaid increase in sales tax to go to those earmarks. And so we had to work that out. And
So who put earmarks in that, Senator?
I don't know who would have ever put earmarks, especially transportation earmarks. But so, I mean, that's part of the process of trying to make sure that we have all I know is that our fiscal analyst, a couple of them have been working, they usually do this at the end of the session. I know a couple of them stayed up all night, one night, another night, the following night. We're just trying to make sure we get it right, and they get it right most, if not 100% of the time, 99.9% of the time. We'll release it when we feel like we have it right, okay?
Senator Hemmer, you said you were trying to match the fiscal note to the revenues available. What's the number you're trying to match to?
Well, so what we're trying to get is a program that works with the tax increase that was approved by the voters. As mentioned, we're going to put in another 15 out of the general fund. There's going to be a $15 million assessment from the hospitals. And we want a fiscal, and well, if we've drafted the bill the way we think we have, then the fiscal note should match those expectations. And so, and we've also put in place, you know, some backstops, if you will, by allowing Department of Health to access certain restricted accounts for Medicaid in case there is an overrun. But if we've drafted the bill the way we think we've drafted it, then the fiscal note should match those numbers, right? And that's what we're trying to make sure is the language in the bill match our expectations so that we feel we understand what we're funding. And if all those things come together, then they should all be consistent.
So when people say SB 96 provides less coverage at a higher cost, the higher cost part is correct, right? Because it's $30 million more than the sales tax increase approved by voters.
In the short term, it's true. In the long term, it's very, that's the exact opposite. That's what we're looking to do, is make a short-term investment that sets us up in a more sustainable position long-term. And we're willing to do that to keep the program viable and make sure that we can manage the budget in a prudent manner.
When you say a short-term investment, that's the $15 million appropriation. The hospital tax is ongoing though, right?
No, the plan is the
No,
hospital
I
tax.
think
will go
if it,
That goes
what
away.
we're trying to do, we call it the gap, what are we calling it?
The coverage gap.
Coverage, well, the period of time from April 1 to the we get the waiver.
Oh, we
The
haven't
bridge,
named that.
the bridge.
The bridge.
we call it The bridge. I gotta get terminology right. During the bridge period of time, it's more expensive. After the bridge period of time, it's much less expensive.
Right.
So I take it part of what you're looking at is how long that $30 million would, and that covers the gap between 90-10 and 70-30. How long that would cover that gap?
That's what we're trying to
What's-
figure out.
Do you have any estimate at this point?
Our goal is to have something in place at the end of the day, whether it's whatever it is. Our goal is to expand Medicaid, okay? I know on the floor the other day we heard we're not. Our goal is to expand Medicaid like the voters wanted, and we want to fund it in a way that keeps it expanded, ideally through the entire fiscal year. Does this 30 million cover that far? That's what we're trying to figure out. How far does it go, and what do we need to do to make sure that we're listening to the voters, but also balancing that against our job to manage a budget.
So,
Just a quick question, that 30 million figure, where does that kind of come from? Is that just the amount you wanted to
It
invest in?
was what we thought was the whole to provide coverage through this bridge time period to give us time to get the 90-10 waiver.
And that's based on the estimated length of time it would take to get that
Yeah.
waiver. correct?
Projections.
Yeah,
and
it's all
you're,
projections.
you're saying the goal, when you said the bridge through the fiscal year, are you talking about the end of the current fiscal year or the upcoming fiscal year?
We're looking at June 30th, 2020, so 18 months from now. That's
Okay,
what
so-
we're trying to fund till.
So the bridge would, you're trying to plan for a bridge that could last as long as
18
18
months.
months for the 30 million?
Because Department of Health, when they enroll people on Medicaid, they have to be looking ahead. We don't want to kick people off. And so they have to be thinking, how many can I enroll and know that I have enough money to keep them enrolled? And so those are where some of these dynamics are coming from.
So
Continuance of care.
So the sales tax increase that's in the Prop 3 plan, you're saying would be enough going forward at the 90-10?
That's what our projections show.
So would
Okay,
be
that's
enough, it would be
opposite what
enough
we've
if with all the changes we made.
Yeah.
The COLAs, and taking 100 to 138% at 100% federal government. We've talked about that before.
Leaving, so we're still only going to 100%. Does that answer your question, why it works, why it's enough? We're still funding up to 100%, and we're leaving from 100 to 138, funded federally 100% on the Affordable Care Act exchanges.
So what's the price tag for that 138? What would the 10% be for that
I don't
population?
remember off the top of my head, I might have to get back to you.
Okay. And the other question I had about that population, the 100 to 138%, you say it's about 41,000 people
That's how many are on the exchanges
now?
now.
Okay, so how
Because they
many
have
people?
access to coverage right now.
Well, no, they have, there's a difference between having access to coverage and buying coverage, right? So are you saying there's more than 41,000 Utahns that fall into that number that aren't covered?
Probably, but I don't know the number.
How, okay, so we know 41,000 are, but we don't know how many people that would
I've
get
seen
coverage
that
under
number, I
Prop
just
3,
don't know it off
but
the
not
I've
under
seen
your
that
plan.
number.
That's a good
Okay.
question.
Yeah, I've seen that
Okay.
number, I just don't know off the top of my head, that's my
Okay,
guess.
maybe,
I'll guess
maybe
wrong.
we can talk offline. Okay, thank you.
Senator Iwamoto, any comments?
I came in late, but I know we have the governor's projections. Did you have those?
Tell me about those.
So they had I think it says for year 2025, 110.7 million, and the other program savings, that's from the sales tax, would be 49.5 million, and so the total's 160.2 million. And then, that was the total, and then the costs for expansion costs would be 121.7 million for behavioral health and 20.5 million for administration. That's just what I had, so there would be 10 million left over, but it doesn't cover COLA rate or the woodwork effect too, but that's not, the woodwork effect costs would probably be the same under Proposition 3 and what we heard from Dunnigan, in the meeting. But that's just the latest that I heard.
Clarify that. So the numbers we saw from the governor's office were in 2 years a $10 million shortfall, in 4 years a $65 million shortfall in Medicaid expansion. Those are the GOMB numbers. And you may have something different, or maybe they've changed some of their assumptions. But that's what we're trying to protect against, frankly, is a $65 million shortfall in 4 years from GOMB's projections. Carry that out more years, it gets bigger every year. And that becomes an unsustainable number. And when the way we manage our budget, I'm probably gonna get kicked for saying this, the accordion is typically education, right? They usually get extra money if there's extra money, but if there's a shortfall like we saw a couple of years ago, they get hurt. And so, me personally, I'm not willing to put Medicaid at a priority over education and over everything else. I think we should manage our budget and choose our priorities as we can as legislators. And I'm not ready to say Medicaid is the #1 priority for the state forever at the expense of every other priority: transportation, education, other social services. And that's really what I think our Senate Bill 96 accomplishes. It does expand Medicaid, but it doesn't put Medicaid at the single #1 priority over everything else forever.
Responsible way. Other comments? If not, anything else with Medicaid today? We passed a lot of bills this week.
There was
We didn't even vote on Medicaid.
one more
Yeah,
Medicaid.
so, but it'll be here Monday, maybe Tuesday, maybe Wednesday, who knows? But hopefully we'll have a fiscal note and pass it out sometime early next week.
There was an amendment proposed, there will be an amendment proposed from Senator Escamilla that would, if you don't get those federal waivers by April 1st, it would have Proposition 3 just take effect as planned. Is that something that the majority would support? These waivers, someone pointed out to me, I mean, you passed the work requirement waiver last year and you didn't get it before voters voted on Proposition 3, and the other one that dealt with chronically homeless people, it took more than a year to get that approved as well.
So the plan, Senator Hammer, I think the plan is to fund it for 18 months. So, and I think if we had something like that in the bill, it may diminish the probability of getting waivers. If whoever you're talking to or negotiating with knows that there's a hard date, that they're gonna get what they want anyway, pretty hard to negotiate. So I don't know, I think we may end up there over time, but to start there, I think would be difficult.
So I have a question, and Senator, you mentioned this just a moment ago. I believe your quote was, "Our goal is to expand Medicaid the way the voters want it." Correct me.
They wanted expansion. I'm not saying we're doing Prop 3. I'm saying they wanted expansion, we're expanding.
No, okay. Do you, and it's a perception issue, do you have the sense that, rightly or wrongly, you are perceived as something other, having a position something other than this one?
I do think that the perception is that we're not expanding at all. And I think that's an incorrect perception.
Perception.
Yep.
Okay.
We are expanding. There's approximately 70,000 lives in the coverage gap. So that's where so can I throw out some numbers? Is that okay? Give me a second, if you don't mind. So these are from our Department of Health that I got earlier. So right now, we cover children and pregnant women up to 133% of the federal poverty limit right now. We cover the elderly and disabled up to 100% of the federal poverty limit right now. Parents, we cover them only up to 60% of the federal poverty limit right now. And the homeless, we cover up to 5% of the federal poverty limit. So we're going to take those parents, and I'm about to misspeak perhaps, I assume the homeless, but this body, we're going to provide coverage for them up to 100%. Kids already have it, elderly already have it, disabled already have it, pregnant women already have it. But we're going to expand for the parents who otherwise don't qualify for Medicaid, and presumably the homeless, up to 100%. And the number there is that it's estimated 66,700 uninsured lives. These are adults from 19 to 64 years old, from 0 to 100% federal poverty limit. So those people, we will be expanding and providing Medicaid coverage for that population under this bill. So we are expanding, even though I think perception is that we're not expanding.
So where do you think the perception comes from?
You know, done a poor job of explaining, I think.
But
To get the word
again,
out right.
Yeah.
but again, no one can tell us how many people would be eligible between that 100 and 138% for full Medicaid expansion that
That
aren't going to
number's
get
out
it.
there, I just don't
Yeah.
remember it, and I don't have it in this text. I
Yeah,
would read it to you.
but you know what I'm saying,
Yeah.
there is a group of people that are being left out.
And our thought process though
Go ahead.
is that they have, and I get this, not Medicaid, I get that. They have access to highly subsidized health care on the Affordable Care Act exchanges. It's not free, but it's highly, highly subsidized. A person at 100% of federal poverty limit, their premium is capped at 2%, 2.08% of their income. And that works out to be about $22 a month. I get that's not free, but that's pretty inexpensive and highly subsidized insurance. That's covered, that's paid 100% by the federal government. So this notion even that we're leaving money on the table, the federal government is sending that money back to the state of Utah. They're just doing it in the form of a insurance subsidy as opposed to a Medicaid program. So the dollars are coming back. Those people, that group does have access to highly discounted health care.
But what about the people between 100 and 138?
They have access right
But,
now.
I mean, do they also, like, is there also an income cap in the same way for those folks?
There's a, so, and you can look it up online, or I know the bottom one is 2.08%. I think that goes up to 133% of federal poverty limit, where that starts going up the cap on the amount they can pay for their premium. But they are capped, so from 100 to 138, they're capped at 2.08% of their income.
It's, one thing the bill has in it that maybe we haven't talked about is I've heard from a lot of people, and I don't believe this is an initiative, I could be wrong, but I think it's good whether it is or not, is that I hear from people that say when they get a job and they leave Medicaid, they can't afford to take their job because they don't have health insurance. And so what the bill does is actually allow them 12 months of coverage. So it actually allows them to get employment and keep their insurance, the current Medicaid insurance, so they can make that transition. So there's other things, we'll probably get into more details, and I'm sure we're going to be talking Medicaid maybe Monday. But so with that, are there other questions or something else?
Can I just ask
Let's move
one
on.
very quick Medicaid
Okay, one more question, I think we have to move on.
Just wondering, the voters, obviously approved a sales tax increase. Was there ever any talk, I wonder, about just adjusting that sales tax increase up a little bit so that it would cover that full 138%?
I haven't had that conversation, and I don't know that I'd be supportive of that either. I don't know. Utahns typically don't vote for sales tax increases.
But
They did this time.
And we're keeping it in place.
Last question.
Yeah, and related, it's a sales tax question, but it's not a Medicaid question. So you have the UEA up here today. The UEA is saying don't do a tax cut, put the money into education. You made the promise years ago that when the economy got better, public ed would be funded in a way that would be commensurate with the economy. So what do you say to no tax cut, put the money into education?
Senator Miller?
So, we're always managing multiple priorities here. Education is a top priority. I don't think if you talk to any legislator, they wouldn't say education is a top priority. And we're going to be working hard during this session to be able to maximize the support for education that we can do, while also balancing the other kinds of issues that we need to deal with in the state. And if you really look at it, I mean, the opportunity here to be able to do several things that I know are competing things, but to be able to modernize our tax code, to support education, to try to try to fiscally, responsibly do Medicaid expansion. We're just going to be balancing those issues through this session.
So you think you can do both? You can fund education the way it should be funded, and you can do a $225 million tax cut.
I think we can make a significant investment in education. Now, how much is enough is always in the eyes of the beholder. Different people have different views of that, but I know that there's a commitment to fund education during this session and to make sure it's a very high priority in our budgeting process.
The last 4 years, we've put $1.2 billion into new money into public education. We'll continue to follow that pattern.
Last year was a record. Up and down. Okay. Okay, anything else? Thank you.
President, we do have some social media questions if you
couple
want.
media questions, yeah. Let's, go ahead.
So we have a question from Twitter about term limits. Can a bill be passed so we have time limits on how long a person can serve in a public office?
Senator Vickers?
The answer is yes, a bill could be passed.
Okay.
But we'd ask, is it needed? I think how many, we have 6 or, I guess it
7.
depends on when you go to, but 5 plus new senators.
Really
And
7 from
yeah.
last session.
7 from
To
last
give you a
session.
feel for that, I've got a picture in my office down in Cedar City of when I was in the House, my last 6 years ago. And of those 75 people, 22 are left in the House in 6 years. That's pretty good turnover.
20 new House members, 7 new senators. We're turning pretty fast here, maybe even, yeah, anyway.
And then another question from Twitter. Why are the oil refineries zoned further from Salt Lake City?
Not zoned further away.
Why aren't they further away? I don't think any of us had the answer to that. They were here, we had a group here in the, I guess at the time they drove the Golden Spike, you saw them with hats on in the gallery. I have no idea, none of us were around then, but why they put the refineries where they did, none of us know. They're there, and it'd be very difficult to move them, but I think that's a good question.
A lot of cases like that, things were quite a ways out then, at that time, but then we've grown out to them. Sugar House Park used to be a long ways away.
That's where the prison was.
And that's where the outskirts, far outskirts of the city was, and now it's
Yeah.
not even in the middle of the valley, so.
Any other questions?
That's it for today.
Thanks. Appreciate you being here.
No one asked my noxious